Healing from the Centre, taking traditional Aboriginal medicine mainstream. Written and produced by Marinella Padula for the Australia and New Zealand School of Government, December 2020. This video case montage was created for educational purposes. Aboriginal and Torres Strait Islander people are advised that it may contain names and images of persons since deceased. Aboriginal and Torres Strait Islander people overall experience poorer health than non-Indigenous Australians, including higher rates of chronic disease, mental illness and comorbidity. One reason is inadequate access to appropriate healthcare. Logistical obstacles, financial constraints and an often complex system play their part. So too does distrust of authorities and lack of cultural competency. For example, clinicians not appreciating the ongoing impact of colonisation and intergenerational trauma. Having providers that understand their needs and respect their identity and values influences people's willingness and ability to receive treatment. Community-led healthcare services regularly outperform mainstream providers for Indigenous patients. Institutional racism, which includes discriminatory policies, practices and structures, is another driver of health inequality, even in the absence of interpersonal racism. Governments can point to some improvements in cultural responsiveness. Today, more than 40% of clinical workers at Indigenous primary healthcare services are Indigenous. National surveys suggest that most Indigenous patients report respectful interactions with doctors. However, government data also indicates that 1 in 5 have experienced unfair treatment from healthcare workers. Aboriginal and Torres Strait Islander people are more likely to leave emergency departments before being seen, experience preventable admissions, or self-discharge from hospital early. Numerous policies and programs, including COAG's 2007 Closing the Gap initiative, have only produced modest gains in health outcomes. There is still an 8-year disparity between Indigenous and non-Indigenous lifespans. One group believes the answer resides within the heart of the country, amongst the Ngangkari, traditional healers of Central Australia. Bridging the knowledge gap. When Italian human rights academic Francesca Panzeroni began looking at Indigenous healing practices in Australia, she was surprised by a paucity of information. She was also surprised that Aboriginal medicine had no formalised role in national health policy, unlike traditional medicine in Canada and New Zealand. In 2008, Dr. Panzeroni embarked on a 4-year journey which took her to the Anangu, Pitjantjatjara, Yankunytjatjara, APY lands of South Australia. There she saw 60,000 plus years of accumulated knowledge in action. She describes the Ngangkari as kind of like a mixture between a general practitioner and a psychiatrist all in one. For the Ngangkari, physical health is indivisible from mental and spiritual health, which is underpinned by connectedness to kin, country, community and culture. Issues in one area can manifest as problems in another. Illness and dysfunction may have natural causes or be induced by malevolent spirits and curses. Ngangkari treat a wide range of conditions including infections, injuries and viruses. However, they are especially known for their ability to deal with mental disturbances such as anxiety and depression. Ngangkari speak of seeing and communicating with spirits in order to diagnose ailments. Most patients report feeling relaxed, positive and unburdened after Ngangkari sessions, often with a lessening of symptoms. However, some experience quite dramatic results, including relief of chronic pain and restoration of mobility.
Some people, they get really sick, like losing family or losing country. That's why people get sick without spirit. Only spirit can help. Because, the spirit, it's connected to the head and we can look after our spirit.
I got one of my regular clients to come along to an appointment, and I watched her walk out of the room without her really walking. She was unable to walk prior to that appointment, unaided, since she had 3 strokes previously years ago. So that was a really emotional day, and I guess proof that I got to see firsthand, plus my own benefits.
You have to go back a few hundred years to time before modern medicine, where doctors were concerned with a patient's spirit. I think that's been lost in a lot of ways in modern medicine. It's become spiritless. What I like about this healing is the spirit's still alive.
So I'm a bit nervous and mostly excited to be going into this room with Debbie and Sean, the healers, to have my own experience and to check in with my spirit. So let's see what they have to say.
Sometimes when you worry or sad, like look behind, you're bringing stuff back here. Sometimes they cause energy, no energy, and mental. Worry too much.
That was amazing. I guess it's a very powerful and emotional experience. I think having that kind of direct contact with your spirit, something inside you that you just have never really, I've never really thought about something like that, so it's a bit confronting. I can't really tell you what kind of effect it's had on me physically just yet, but I'm feeling open-minded, and Debbie and Sean really got in there, and I think that what they've done is pretty cool, so we'll wait and see.
Treatments involve at least one of several techniques: touch, breath, bush medicine, and sacred rituals. The goal is to restore the spirit, banish negative energies, or remove blockages, which alleviates discomfort and promotes healing. Interventions might also require treating the patient's family or ritual cleansing of spaces. If someone lost their spirit, the healers, Nunkari, they grab it, bring it back, and we always put it back in their body so they can feel okay, explains APY Nunkari Cyril McKenzie. He began his healing apprenticeship aged 5, mentored by Nunkari relatives. Nunkari are often selected to become trainees in early childhood. Elders spend many years with their proteges, transferring sacred knowledge and skills through song, ceremony, and hands-on experience. Getting organised. Dr. Panzeroni's research concluded that a holistic two-way healthcare model incorporating conventional and traditional medicine would have many benefits for Indigenous Australians, including a more comprehensive assessment of patients' ailments, a reduction of cases of misdiagnosis, calming effects on patients, and enhancing compliance with Western medical treatments. She also discovered widespread demand for Nunkari amongst metropolitan and rural health services in South Australia. Clinicians who had seen Nunkari at work valued their presence. Meanwhile, Panzeroni saw little evidence of adverse events or conflict. Dr. Panzeroni instead found that the biggest obstacles tended to be bureaucratic. Healers, for instance, had no official status or fee schedule. Some Nunkari didn't even have bank accounts, said one senior administrator. Payments open up a very big can of worms. Because you have to talk about the accreditation, the registration of Nunkari. How do you apply the Western model to traditional use? Said another, the treatments are, I guess you need to have a pretty open mind about some of the things that a lot of people experience, because you can think that it's just magic or wonder how that actually happens. But it is not a rational model, it is very alternative. But there were already examples of how a two-way model could work. A notable one being the Nunkari program established by the NPY Women's Council. It provides traditional healing to people in a variety of care settings across the Nundjara, Pitjantjatjara, Yankunytjatjara NPY region of Central Australia, which encompasses APY lands. As well as complementing standard treatments, Ngangkari also work with conventional medical practitioners to develop services specially for Anangu patients. The program has been acknowledged nationally and internationally, garnering multiple awards. By the early 2010s, South Australia's Health Department recognised the Ngangkari's role in Aboriginal wellbeing and developed a referral program. However, implementation was limited, as was usage data. Individual organisations did engage Ngangkari on an ad hoc basis, but reliable access to healers was difficult. Consistent funding was another barrier, and costs were often prohibitive, especially in urban areas. After extensive consultation, Panzeroni, along with Ngangkari Debbie Watson, Taylor Cooper, Wijiti George, Margaret Winton and Mukai Baker founded ANTAC, the Anangu Ngangkari Chutaku Aboriginal Corporation. Established in 2013, it became the first organisation of Aboriginal traditional healers in Australia. Healers are credentialed according to Ngangkari law, the traditional knowledge system passed through the generations that sets out treatment methods, ethical standards and training requirements. The founders developed a hybrid Aboriginal Australian governance model featuring 5 Ngangkari directors. ANTAC created a register for recognised APY healers, a payment structure for services, and an Adelaide-based clinic which is open to Indigenous and non-Indigenous clients. In addition to private consultations, ANTAC offers workshops and site visits to places such as correctional facilities, health centres and hospitals. Going metropolitan. Having a central organisation enabled the Ngangkari to forge partnerships. In 2019, the North Adelaide Local Health Network entered into a formal agreement with ANTAC, which allowed healers to practice at network sites. We need to trust the bloodlines are in place and Ngangkari healers are recognised by their community and trained on the job, explains Executive Director of Aboriginal Health, Kurt Towers. We accept traditional credential methods that allow them to work as professionals in their own right with our doctors, nurses and other healthcare workers. Indigenous patients wanting to see Ngangkari could now simply request an appointment. As you might refer to social work for psychosocial needs, you refer for spiritual and traditional healing needs, Towers says. Initially offered in primary care settings, Towers discovered a desire to extend Ngangkari services into hospitals as well. Towers, a Wiradjuri man, has personal insight into the issue. He had seen how Ngangkari had helped his mother during her treatment for cancer.
Aboriginal people have a right to access comprehensive, culturally appropriate and accessible primary health care. In collaboration with our Ngangkaris, we've been able to deliver over 50 designated Ngangkari clinics within our Wadapuruna primary healthcare services.
So it's about offering the services of Aboriginal traditional healers in all settings across Naarlen, including the acute, mental health and primary health settings.
As an Aboriginal person, I strongly believe in the cultural connections that we have because we're spiritual, physical and emotional people. And recently, as a person who sadly fell sick after a hip operation in hospital, and so I called on the Ngangkari to come out and give me a little bit of a diagnosis and help.
Our consumers wanted the same Ngangkari service delivered within the hospital and mental health setting. So in collaboration with key clinicians within mental health in the hospital, we have now got a great framework to ensure our Ngangkaris can deliver that same service within the hospital.
Aboriginal health worker Kelly Matthews knew many clients who were hesitant to visit a clinic. It's a fear, she says. It's how a doctor communicates. Sitting in the sitting room, they feel self-conscious. I hate it myself and my skin is pale. But after the Ngangkari began visiting her Riverland Centre, bookings surged. Panzeroni, now ANTAC CEO, routinely hears similar stories. I remember once the manager of the hospital said to me, "Oh my God, I have never seen so many Aboriginal people in the hospital smiling and being so happy to be here." ANTAC Antac healers also went on the road, taking their skills to health services and Aboriginal communities in Victoria, New South Wales and Western Australia. Despite the Nunkary's very different approach to healthcare, medical staff have been supportive. Says Towers, "There's been a real want and need from our clinicians in the hospital and the mental health centre to want to incorporate traditional beliefs and spiritual care to complement the mainstream medicine." Towers has heard of certain cultural phenomena, like seeing visions, being mislabelled as psychosis. The Nunkary presence in hospitals helps doctors better understand patients, but also fosters greater appreciation of Aboriginal culture. Another benefit, Dr. Panzaroni notes, is the creation of sustainable employment for Nunkary. In 2020, Antac had a register of 14 practitioners in different locations around the state. It also helps support the next generation of Nunkary and preserve the kinds of ancient knowledge and traditions already lost to many parts of Australia. Connection to culture is recognised as an important protective factor and source of resilience for Indigenous peoples. Little faith. Clinicians increasingly appreciate the impact of psychological, social and cultural factors on health and well-being. However, care is often rushed and fragmented, making it hard to delve beyond the physical. But not everyone embraces the idea of embedding spiritual healers in medical settings. Complementary and alternative medicine, CAM, which includes traditional modalities, is popular amongst Australians. However, many therapies have been criticised for promoting or unscientific ideas and treatments. Patients avoiding or delaying conventional care in favour of CAM also risk poor outcomes. In 2019, the federal government excluded most alternative therapies from health insurance rebates after the majority were found to be clinically ineffective. However, Towers and Panzaroni are clear that Nunkary treatment is not a substitute for conventional medicine. Far from being opposed to whitefella healing, Dr. Panzaroni found that Nunkary endorsed modern methods, particularly for conditions that were unknown pre-colonisation. In fact, they often advised clients to consult a doctor. Null and Antac also devised their program with clinical input to ensure that treatments would not interfere with prescribed therapies. Outside Antac, though, not all Nunkary embrace the idea of working within the system, nor do they understand how spiritual healing can be regulated. Professionalisation also reignites questions concerning who should have the right to monetise traditional knowledge and medicinal products. Another view is that addressing dispossession and economic disadvantage is the real key to fixing health inequality, and that progress will be limited until then. On the horizon. So far, the Nunkary appear to be having a positive impact at clinics around the state and country. However, Antac is also keeping track of treatments to provide an evidence base for Nunkary care. Ultimately, Antac hopes to see federally funded traditional Indigenous healing made available across Australia to all patients. In 2019, lack of progress on closing the gap prompted a major overhaul. This time, however, Aboriginal peak bodies partnered with COAG to redraft the framework. A report by member organisation, the Lowitja Institute, noted the centrality of culture to Indigenous health and called upon the government to recognise and restore Indigenous wellbeing methods and practices, including healing, plant-based medicines and ceremony, through development of social enterprise. These should be utilised within healthcare service settings and provided appropriate intellectual property protections. But, wrote the authors, the challenge for health systems committed to achieving positive change is how to shift institutions and thinking beyond embedded medical models of health towards a model that puts culture as the foundation for good health and well-being.